Hello, my name is Bruce Rosen from the Hebrew University of Jerusalem, and welcome to Israel Healthcare Highlights, where we share interesting information and inspiring stories about Israeli healthcare with English language audiences, English speaking audiences from around the world. Our guest today is Malke Borow, who is the director of the Law and Policy Division of the Israel Medical Association. We're going to focus on what Malke and the IMA, Israel Medical Association, are doing to help new Olim, immigrant physicians. But before we do that, Malke, please tell us a bit about yourself and your background and your current position.
Okay, sure, Bruce. Thanks for having me. So I grew up in the New York area in the United States, where I attended Columbia Law School and got my law degree there. And I worked for a few years in the States in a large law firm in the area of health law, among other things. And then about 28 years ago, my husband and I and our 4 small children made Aliya, where I managed in part thanks to your help, Bruce, to land really my dream job at the Israeli Medical Association, which I love because it's really a combination of law and policy and international relations. The department which I manage, as you mentioned, is the Division of Law and Policy, and we do their actual legal work, of course, but also, as I said, health policy, legislation, international relations, ethics. So it's quite diverse and interesting.
Terrific, terrific. Now, I understand that the Israel Medical Association, the IMA, is playing an important role in helping immigrant physicians, Olim physicians, make Aliyah. Could you tell us a bit about that, please?
Sure. So, the IMA has always been dedicated to physician Aliyah. The original founders of the IMA were themselves Olim from Germany. And in fact, one of the fundamental principles written in the IMA sort of decisions, which are approved every 4 years at the General Assembly, approves and endorses and encourages physician Aliyah. I would say the IMA helps physician Aliyah in several different roles. First of all, it's important to note that the IMA has within it what's called the Scientific Council, which is the body that's in charge of physician residency and specialty certification. So while the Ministry of Health is the one who licenses Olim physicians, the IMA approves their specialty certification. So first of all, just on the IMA side, I think the IMA in general, first of all, is heavily involved. As I mentioned, we participate in Knesset committees on the issue. We try to see how we can help. We have an international relations division within the general division, which is there to help Olim in any capacities we can. And very frequently we'll get questions from Olim physicians. Of course, we help them when they come, if they want to, us to check their contracts or things like that. We have professional associations in each field, which are very helpful for Olim physicians to meet their colleagues and network. And on the side of the Scientific Council, so we're always looking for sort of ways that we can, on one hand, balance, because we do need to maintain the high standards of medicine in Israel, of course, but at the same time, to minimize bureaucracy and to help them. And one thing that I will just mention, which is really hot off the press just from yesterday, is until now, Olim physicians who came to Israel and wanted to get their specialty certification recognized had to do a 3 to 6 month period of adaptation. And as of yesterday, for physicians coming from the US, Canada, England, and France, that has been canceled.
Wow,
in almost
that's
all
great
cases.
news. I know a lot of
I think that's really great news for a lot of potential Olim. Yeah. So they still need to submit their application, but as long as everything's in order, they can dispense with that. So that's just one example.
Okay, that sounds really important. Now, how does this work that the IMA does around physician Olim, how does it fit into the broader role of the IMA in Israeli healthcare?
So, the IMA, in English it's called the Israel Medical Association, but in Hebrew it's interesting. We call ourselves Histadrut HaRufu'it, the medical association, rather than Histadrut HaRufim, the physicians association, because we very much see ourselves not just as a trade union for physicians, but as an organization that is really dedicated to health in Israel. And as part of that, we feel that it's important to get Jews in general, physicians in particular from all over the world to come to Israel. That's sort of on a Zionistic ideological aspect. And of course, on a very practical aspect, there is a physician's shortage, particularly in certain specialties in certain areas in the periphery. And so we feel that it's important to get more physicians here to fill those spots.
Terrific. Now, what are some of the challenges that are faced by physician Olim, and how do you at the IMA try to help with those challenges?
So I think that some of the challenges are fairly obvious. I think that obviously the language and culture is a challenge. That's for any OLA, not just physicians. I think the fact that, again, the whole networking and we'll call it protectia aspect, Olim don't have that broad base of support of friends and colleagues that they've gone to the army with, gone to school with, etc., and that makes things more difficult. And of course, the different systems pose a challenge. And here we have a national health insurance, a public system. And in fact, the whole public versus private system, I think, is particularly challenging. The whole disconnect between the hospital system and the ambulatory system is sometimes a bit of a challenge. As far as how we can help with that, there's not that much we can do other than really try to provide support and help in specific instances. But, it's a different system. It's a different country. And it just takes time.
Terrific. Now, of course, there are other bodies involved in this. There's the Ministry of Absorption, the Ministry of Health, the nonprofit organization Nefesh B'Nefesh, and try stuff all of it. How does your role fit in, and to what extent do you work cooperatively with those other groups?
Yeah. So, I think this is clearly a mission which requires a lot of interdisciplinary cooperation. And we work very much hand in hand with, as you said, the Ministry of Health, the Ministry of Absorption, and Nefesh B'Nefesh. I just recently participated in the MEDEX conference that Nefesh B'Nefesh had in the States. And actually, one thing that I'd like to point out, which I think was terrific that they did this year, was in addition to my giving a talk on just what it means to be a physician in Israel, they had a panel of Olim physicians whom I, asked specific questions to, and people could hear from physicians who'd made Aliya themselves. And it was very encouraging to hear them say that despite all the challenges which we just mentioned, it was the best decision that they ever made. And I think that was more helpful than anything that I could say sort of on a theoretical level.
So when we put this up on the website, on the Israel Healthcare Highlights website, we'll add a link to that discussion. But my final question is, what advice do you have for physicians in English-speaking countries who are considering making Aliya?
So I guess maybe I'd choose three things. First of all, is try to learn as much Hebrew as you can. You can get by in English. Certainly a lot of the medical work in Israel is in English, but language is key to integration in general and professionally as well. So that is one thing. The second thing I would say is to come with realistic expectations. It's not going to be the same as working there. And I think that, if you're not expecting sort of unrealistic things, you'll do fine. And as part of that, I would say to recognize that, yes, you may be giving up certain things, but there's a lot to be gained by working as a physician here. I think, first of all, for those for whom it's important, you're working in a Jewish country with all that entails, you'll get questions that have to do with Jewish life. I think it's a more family-friendly society here, and that's significant, perhaps more for women, but for men as well. We're a startup nation. There's a lot of opportunities in high tech. There are many things which you specifically can get here, which you won't necessarily get in other places.
Good. So this has been a really informative and interesting interview. Malke, thank you very much.
Thank you, Bruce.